Welcome to this course on spiritual assessment. When I was in my graduate psychology program in the 1970s, we were told that if a client wanted to talk about religious or spiritual issues, we should refer them to a pastoral counselor or religious professional, but not discuss any religious or spiritual issues with them. In a sense, this was an appropriate approach that met the APA ethical guidelines for professional competency. My school, as is still true of most schools, did not prepare us to work with clients' religious or spiritual issues. But evidence we review later in this course shows that mental health clients bring religious and spiritual issues into therapy and want to be able to discuss religious and spiritual problems and strengths with their healthcare providers. And today, conducting a spiritual assessment has been recognized as the gateway skill to integrating client religion and spirituality into treatment. My introduction to formally assessing spirituality came over 30 years ago when, as a psychologist at the San Francisco VA Medical Center, I was asked to lead a dual diagnosis group. The patients were all required to be in a 12-step program. But in the group therapy sessions, it became clear that many of the patients had not made any connection to a higher power or other key elements of the 12-step program. They were attending only to comply with the mandate of the program. I initiated a group called Finding Your Higher Power and asked the VA Medical Center chaplain, a Lutheran minister, to co-lead it with me. But I felt the need to conduct a more thorough spiritual assessment of the patients in order to know how to focus the intervention. In 1988, psychology did not have much to offer in this area. I was able to obtain a copy of St. Elizabeth's Hospital's Spiritual Needs Assessment Form, and there were also examples of spiritual assessments in the nursing literature and pastoral counseling literature that I was able to use to conduct spiritual assessments. In 1994, as a result of my work on the new Diagnostic and Statistical Manual category Religious or Spiritual Problem, I got requests to conduct training related to this new category. My trainings always include spiritual assessment as the first step to including or even knowing whether to include a spiritual component in a client's treatment, wellness, or recovery plans. Demand for training increased in 2001 when the Joint Commission on Accreditation of Healthcare Organizations issued a clear mandate that there be a spirituality assessment in each patient's chart. Then, in 2012, I was hired by the Los Angeles Department of Mental Health to help provide training in spiritual assessment for their staff of over 800. But the LA Department of Mental Health requested a more strengths-based assessment approach to religion and spirituality that was more in line with the strengths-based recovery approach that has become the dominant service model for mental health treatment. I also wanted to be able to assess possible religious or spiritual problems or struggles that could be interfering with accessing social support from an organized religious or spiritual group or engaging in religious or spiritual practices. So I created a brief 3 to 5 minute interview that covered both a client's strengths and any religious or spiritual problems or conflicts. This interview is called the SSOPP, an acronym for S, screening, that is finding out the role religion and spirituality play in the client's life and worldview. S for strengths, ways the client uses religion and spirituality to cope. O for organized, participation in a religious or spiritual group. P for personal, these are religious and spiritual practices the client does on their own. And P for problems. These are negative religious coping methods and struggles. The SSOPP has been field tested for over 30 years in a variety of clinical settings, both inpatient and outpatient. I hope you will find it a useful tool for understanding your client's strengths and challenges in the areas of religion and spirituality.